So today we're going to start another important chapter, which is actually principles of routine exodontia. So let's start it. Bismillahirrahmanirrahim. This topic is actually related to the oral surgery. So basically in this chapter we will study about the extraction, their indications, contraindications, how actually extraction is performed, the complications of extraction that occur post-operatively. So the definition of extraction is actually the painless removal of the whole tooth. When you actually remove a tooth in such a condition that the patient does not feel the pain, or the roots with minimum trauma either, that it does not cause so much trauma to the investing tissues or surrounding tissues, so that the wound heals uneventfully and no post-operative prosthetic problem is created. So first you should have removed the teeth painlessly or with the minimum trauma to the surrounding tissues. Okay, then because to heal the wound easily, and there should be no post-operative prosthetic problem is created. Okay, so first indication about study is caries. We all know that caries is actually the that is most commonly infectious disease that it has been seen in the dentistry. When caries reach to a level where it actually destroy the whole tooth structure, so then it becomes very important to extract that tooth, and it is the most commonly and widely accepted reason to remove a tooth that cannot be restored. Okay, and non restorable is a judgment call when sometimes there's a complex cost required to save a severely carious tooth. Sometimes whatever that the tooth becomes so much complex, or either the procedure is so costly that the patient do not want to do, and for that patient the extraction is become a very reasonable choice. Some patients also do because of the availability and success of reliable implant supported prosthesis that they can afford. So what they do, they remove that caries tooth and place the implant on that. The second, we have actually a pulp necrosis. Pulp necrosis is another very important indication of the removal of tooth. So what happened? Either it is a pulp necrosis or irreversible pulpitis that is not amenable to an endodontics, that cannot be saved by the endodontics, or either it can the patient decline the endodontic treatment. Okay, or when the root canal is so much calcified or so much tortuous, means it has so much twist that the standard endodontic technique is by their means that the endodontic techniques cannot restore or cannot treat that tooth actually. Okay, the treatment has been done but it has been failed to relieve pain, means the patient have done the RCT but the pain of the patient is not relieved, or either it does not provide the drainage, the pain, and the patient do not want to desire the to retreatment. Okay, so pulp necrosis means when sometimes the patient did RCT but either the GP stick has been crossed, or either the patient does not get the relief, or either the tooth is properly destroyed, that RCT fails. Because for RCT we also have some indications that when you can do RCT. Okay, then moving towards another indication is periodontal disease. For removal of tooth is severe and extensive periodontal disease. Okay, why? Because sometimes like we know periodontitis is a very severe form of gingivitis, so in which you have actually excessive bone loss, and due to excessive bone loss the tooth become very mobile. In such situations, in hypermobility, the tooth should be extracted. Okay, then it has also a straightforward choice for implant placement, making extraction a very sensible step even before the tooth becomes moderately or severely mobile. In periodontal disease, we know that sometimes the gum recession happens, The roots are exposed, the bone is lost, the tooth becomes very mobile, due to which the extraction is very important for due to these